No dental treatment will be effective unless you keep your teeth and mouth clean. You have to follow your treatment with routine and proper home oral care. This means doing a sequence of 3 things in order: flossing, brushing, and rinsing. The key is not only to do it regularly, but also to do it right. This means you should brush and floss regularly and after every meal, and at a minimum of twice daily. Here's how. To properly floss, you should wind the floss around each one of your index fingers. Push through each of your teeth in your mouth. Be sure to freely move the floss upward and downward, even sideways, to remove any food particles or plaque that may be lodged between your teeth or under gums. Many people these days use an electric toothbrush, such as a Sonicare electric brush. Whether you use electric or still prefer a manual, the brushing movement is the same. You should hold the brush at a 45-degree angle to your teeth gently, but thoroughly rotate the bristles across your teeth and under your gums with a backward and forward motion. Be sure to also get the top surfaces of your teeth where you bite on or chew your food. Your tongue can also be cleaned with your toothbrush, which will help reduce bad breath. Lastly, it is important to clean the inside surfaces of your teeth with the same rotating motion. When brushing, it is also important to use toothpaste that contains fluoride. It helps harden the outer layer of the tooth called enamel, which will prevent cavities and also reduce bacteria in the mouth. It can also help reverse the formation of smaller cavities. Lastly, antibacterial rinses can also help reduce bacteria in the mouth. Try to use a rinse that has no alcohol to avoid long-term effects. Remember, 3 steps of daily hygiene is the secret to a healthy mouth.
Our mouths are full of bacteria. Bacteria constantly forms a sticky, colorless plaque on the teeth. Plaque that is not removed hardens to form bacteria harboring tartar, also known as calculus. As calculus forms between the tooth and the gum tissue, inflammation of the gums occurs, which is known as gingivitis. Soft tissue, or if you will, gum tissue, pull away from the tooth, forming a pocket which is infected with bacteria. Plaque and calculus spread and grow below the gum line, breaking down the bone and connective tissue. Scaling and root planing is necessary for treating periodontal disease when periodontal pockets are greater than 3 millimeters. Without treatment, damaged root surfaces will continue to harbor plaque and calculus buildup. The plaque releases toxic waste products, which provokes destructive responses from your body, such as swelling and bone resorption. It can result in irreversible loss of bone support around your teeth. As pockets become deeper, damage occurs more rapidly due to the inability to clean these areas. Tooth mobility, tooth loss, and abscesses may occur if left untreated. Scaling and root planing may be recommended as the first step in actively controlling your periodontal disease. It consists of a very thorough cleaning and smoothing of all the surfaces of the tooth and root to remove plaque and calculus below the gum line to the bottom of the pocket. Root surfaces are rough due to deposits of plaque and calculus tartar buildup that are attached to your root surfaces. You can think of it as if it were coral or barnacles attached to the tooth under the gum line. The roughness harbors plaque and bacteria, which is irritating to your gum tissue, causing inflammation. With smooth root surfaces, supporting tissues can then reattach to the tooth surface, or at least decrease the inflammation, encouraging a healthier pocket. Often, local anesthetic will be used to help make it more comfortable for you. A medicated rinse may be prescribed to promote the healing process. Several appointments may be necessary to complete this very meticulous procedure. Periodontal tooth scaling and root planing, combined with a strict home care routine and more frequent dental cleanings and exams, will increase your chances of keeping your natural smile.
Gingival recession, or receded gums, can be a significant dental problem. It typically happens on teeth which have thin overlying soft tissue and/or bone, or are unfavorably located in the dental arch, either tipped or displaced entirely toward the lip or tongue, such that the tooth-supporting bone on one side is too thin to provide adequate support for the gingiva. Gingival recession may be aggravated by regular aggressive brushing and clenching and grinding, or bruxism, particularly if the upper and lower teeth are improperly aligned, which may cause off-axis tipping forces between the misaligned teeth. It can also be caused by prolonged gingival inflammation, which weakens the attachment of the gingiva to the teeth and bone. In patients with advanced periodontal disease, gingival recession may be surgically created on purpose in order to reduce the depth of the gum pockets around the affected teeth. Although surgically created gingival recession may be viewed as unappealing, it allows the patient proper access for cleaning around the teeth. Gingival recession is generally of concern for one of these reasons. Exposed tooth roots can be very sensitive, particularly to cold temperatures and sweets. Exposed tooth roots are more vulnerable to cavities because they're softer and more porous than tooth enamel. This is especially true in patients with chronic dry mouth or xerostomia. If there is insufficient keratinized tissue around the necks of the teeth to resist toothbrushing and food abrasion over time, gingival recession and bone loss can progress to the point where teeth are lost. Gingival recession that is due to periodontal disease may lead to tooth loss, pathologic migration of poorly stabilized teeth, and poor general health.
The first step is making sure the tooth is free of decay. We prepare the tooth for the buildup by applying a mild solution, and then we carefully place the resin material. Some core materials harden on their own, while others are cured with a high-intensity light. Lastly, we shape the core material to accept the crown. Building up a tooth prior to a crown supports the remaining tooth structure, provides better stability for the crown, and may reduce sensitivity by providing insulation for the sensitive inner pulp layer of the tooth. This is especially true for cracks that are located next to fillings, because these can easily break, like this tooth. It broke along the crack, and half of the tooth snapped off. A cracked tooth may hurt when you chew, or be sensitive to hot and cold, but sometimes a cracked tooth that should be treated may have no symptoms at all. It's important to evaluate and treat cracks as soon as possible because they can grow quickly. If they reach the nerve, root canal therapy may be required, and if they extend to the root, the tooth may need to be extracted.
A missing tooth can be replaced in several ways. One common option is replacement with a bridge. A bridge can provide an aesthetic replacement. However, it does require the teeth on either side of the space to be shaved down and used as supports for the bridge restoration. As a result, this irreversibly alters the tooth, and its lifespan may be compromised. Possible complications include root canals, sensitive teeth, and decay around the edges of the bridge. The average lifespan of a bridge is reported to be in the 10 to 15-year range. An implant, on the other hand, is a more conservative restoration, as it does not involve the surrounding teeth. The implant is placed into the jawbone. A post is attached to the implant, upon which a crown is placed. When we compare these two restorations, we can see that both solutions provide an aesthetic replacement of a missing tooth. A bridge, however, involves the adjacent teeth, so if a problem arises, the surrounding teeth may be jeopardized. An implant is a standalone restoration, providing a much more conservative approach to the replacement of a missing tooth.
Have you ever looked inside your mouth at the big teeth in the back? These teeth are called molars, and they have indentations and grooves on their tops and sides. This is where decay and dental caries starts. There are a few things that you can do to help prevent cavities from developing. Brush your teeth twice daily after meals or snacks for 2 minutes. Also, avoid really sugary snacks, sodas, and energy drinks. Otherwise, your teeth could wind up looking like these. The pits and indentations of your teeth accumulate bacteria. If the bacteria are allowed to stay, bacterial aids and enzymes could break down your enamel. Acids and enzymes from foods and drinks can also dissolve away the enamel. Bacteria plaque can also be found along your gums, the sides of your teeth, and between your teeth. This is why it is so important that you brush all surfaces of your teeth by angling the bristles of the brush to get below the gums and in between the teeth. Don't forget to floss every day to help rid your teeth of the fuzzy plaque. When letting plaque remain between your teeth, you can get a cavity there. If a cavity forms in between your teeth, this may result in removing more of your healthy tooth structure than normal to reach and fix the cavity. This area is also the most common area for gum disease to start.
Let's take a closer look at the problems associated with wisdom teeth. The most common problem that occurs is pain and swelling due to inflammation, also known as pericoronitis, which can lead to infection of the gum tissue. Gum disease, also known as periodontal disease, occurs between the second molars and the wisdom teeth as a result. The wisdom tooth and the second molar share the same bone and gum tissue, and when the tissue is damaged, repair or regeneration is extremely difficult. This greatly compromises the health of the second molars, which are very important teeth for chewing. Decay or caries can also occur on wisdom teeth or on the root surface of the second molars. This is sometimes near impossible to treat. If decay happens on the second molar, it often has to be extracted too, and that is a big loss. Wisdom teeth also can cause certain types of cysts that result in significant destruction of bone and damage to the adjacent teeth, bone, and other structures. They can become quite large and weaken the jawbone with potential fracture. Certain cysts can also become more aggressive and become malignant. The concept of wisdom teeth causing shifting of adjacent teeth is not entirely understood by many dentists. However, wisdom teeth are probably a contributing factor to this problem. Many dentists, as a result, recommend removing the wisdom teeth to prevent possible shifting.
Sometimes a tooth is removed and a dental implant is not placed right away. Without a tooth, the jawbone usually shrinks. The result is often significant bone loss. This bone loss isn't the person's fault, it's the natural resorption process that typically causes the bone deterioration. In order to have a dental implant and teeth at a later date, the person may need more bone to anchor the implant. There are several ways to reproduce the bone so that your jaw will be able to accept a dental implant. These are called bone grafting techniques. Socket grafting is bone added at the time of your tooth removal. The tooth will be removed and the bone grafting material will be placed in the hole left after removing the tooth for a 4-month healing process. The bone heals and the dental implant can then be placed. A tooth is placed on the dental implant. For patients that have more bone missing, a technique involving placing blocks of bone in the area with missing bone works well. The blocks are shaped to the desired size and place with titanium screws. They are left to heal for 4 to 5 months. When the bone heals, there is plenty of bone for a dental implant. When it is not possible to use a block, a softer mix of bone substitute is placed where bone is missing and covered with a tarp called a membrane. This graft also grows bone. When the bone heals, a dental implant is placed and allowed to heal, and the final tooth is placed on it.
The normal or physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso- and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw. Conversely, when you breathe through your mouth, your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align. This also produces an incorrect swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth, and your tongue resting on the floor of your mouth, with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing, are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier.